Friends, I am Dr. Amdekar. In this episode, I am going to talk about one of the important contributes of success in our medical practice, and that is communication and counseling. Communication refers to giving a relevant information about the disease to the patient. I am sure we all know that every patient wants to know about his disease, why he got it, how did he get it, will the disease be cured, will there be any complications, will there be any handicap remaining, would it recur again, would it spread to others, and so on and so forth. There are so many questions lurking in his mind, and I am sure as doctor we are responsible to give such relevant information so that it makes him inspired to do his best to get better. However, counseling is one step further beyond communication, and that is we should help, guide and assist the patient to get over the problem, to get over the suffering. Having said this, I must say that we must have a minimum skills of communication and counseling. First and foremost is we must talk in the language that patient understands. The language should be simple, without any scientific terms or jargon, and fluent in a manner that he can understand. And don't forget the ABC rule of communication and counseling. What is it? It simply means you should be accurate, brief and clear, non-ambiguous. Having said this, we must try to develop this skill of communication and counseling, which is a kind of a must for most of us to achieve excellence and rationality. However, the question comes up, are there any hurdles in developing such skills? I feel there are many excuses. For example, a lack of skills is something that we should understand and try to improve, but lack of commitment, lack of willingness to do the best, and finally a lame excuse of lack of time is not acceptable at all. This is a part and parcel of our job in order to achieve quality performance, that is excellence. And this video is just to sensitize all of us the importance of developing this. Now the question comes up that there are many diseases in medicine where the causes are either not known or are very complex to explain to the patient. For example, you have an autoimmune arthritis or a nephrotic syndrome. Now both these conditions are due to autoimmunity. Patient doesn't understand what autoimmunity means, but to simplify this term, we need to tell him that immunity is our defense or fighting system, and it is supposed to fight any intruder that comes into our body. But sometimes, not commonly, it so happens that without the intruder, our immune system feels or misunderstands or misinterprets the presence of such an intruder. So if my immune system feels there is an intruder in the kidney or in the joint, though there is none at all, but there is a misunderstanding, then it keeps on fighting, and the fighting results into damage, and that disease is called autoimmune disorder. Well, this is the simplest way of communicating what autoimmune disorder means. However, the counseling should follow this. So how do you counsel the patient? What are you going to do about it? And how are you going to help the patient? Therefore, you would say that we have number of drugs which can make the immune system behave normally and suppress the abnormal behavior. Once we do that, the disease starts getting better, and such a process may take a longer time, but certainly the disease does get better and controlled. Don't you agree that even autoimmunity is not difficult to explain to a lay person? Let me give another example of a degenerative disorder. Now, many times we see degenerative disorders like an osteoarthritis, where the bones are degenerating in their function, or a degenerative brain disease like Parkinsonism, and many others. How do you explain the patient what is this degeneration? Having given information about the disease, like you would say that your bones are getting weak, that's how you got a little fracture in spite of a very minimal trauma, and we explain why this has happened. Maybe you are short of vitamin D or calcium and so on and so forth. But the problem is, gradually the function is being lost. Now, how do you counsel the state of degeneration? You would give an example that as the person gets old, at the age of 60, 70, 80 and so on, you start losing a bit of your memory, maybe a vision loss, maybe an hearing impairment, maybe you are not very stable, you tend to fall down and keep not your balance. This is called degeneration. Now, if this normally happens at an old age of maybe 70, 80 years or so, if this happens in a middle-aged adult at 30 or 40 years of age, then this is called degeneration. So when a patient of Parkinsonism comes to you, you would tell him that the part of the brain which controls such movements and allow us to freedom of working with our hands or feet somehow has started losing its function. And when it loses its function, slowly progressive loss of function is called degeneration. Science doesn't know why this happens, but if this happens too early than average expected age, then you call it a disease. Having made him understand what this degenerative disease is, you could further counsel him to say that even when there is a defect and a functional loss, there are enough number of centers in the brain or in the bone which can still function well. And you give a simile. You tell him that every cup has a handle, but suppose the handle of the cup is broken, the cup is damaged, even then you can use the cup even to drink hot tea, but you may have to be careful. But beyond losing the handle, suppose one part of the rim of the cup is also damaged, can you not use the cup? Of course you can, but you will have to be very careful to see that you don't damage your lip if you held the cup exactly at a place where that rim was broken. When you give such simile for them to understand, they do understand that even a degenerative disorder can be managed to some extent. And you all must have heard that patient who lost his fingers had learned to even draw or write through the toes. How can effectively we encourage the other functions taking over a loss of function in a particular area? This is very much possible. Friend, this is called counseling, going beyond information. What's the idea of information and counseling? First and foremost, when you counsel adequately and effectively, it's a measure of your honesty, integrity, sincerity, and accountability. That's what you get a benefit. But what about the patient? Patient feels satisfied. Patient feels happy. Patient feels strong faith in the doctor. And if this happens, then with doctor and the patient doing their best, I feel the outcome is excellence and ends up with a divine healing. Friends, therefore, this part is to sensitize all of us the importance of communication and counseling. Don't forget, always do it. The next video will be presented by Dr. Palani Raman, and he has an interesting topic to talk to you, and the title is Early Life Origin of Adult Diseases. I hope you enjoy it. Thank you very much.